Welcome to the deep dive, where we sift through the noise, stack up the sources, and, well, get you those golden nuggets of insight you need. Today, we're diving into something massive, something that affects, well, literally everyone in England. A huge 10-year health plan for the NHS. And we've got the main plan, sure, but also a whole load of supporting documents, public feedback summaries. It really paints a picture.
It does. And our mission today is to really unpack this incredibly ambitious vision for the NHS. We need to understand not just what they're proposing, but why it's apparently so needed now. And crucially, how they think they can actually pull it off and what it all means for, patient care, for the staff, and the whole financial future of the service. I mean, the plan itself says the NHS is at a historic crossroads facing its worst crisis in history.
Wow.
And it gives this stark choice, reform or die.
Reform or die, that's pretty blunt, isn't it?
It is.
So we're not talking minor adjustments here. The plan itself says major surgery, not sticking plasters. And you mentioned the public mood. No one defends the status quo. So, cool, let's get into it. What's driving this need for such radical change? What's the current picture?
Well, the current situation is pretty critical, frankly. You've got millions on waiting lists, sometimes waiting years, lives just put on hold. And then you have the staff, the NHS staff, often feeling demoralized, bogged down by bureaucracy, trying to deliver care.
Yeah, and it's not just about waiting times, is it? There's this sense that society is just getting sicker. Lord Darcy's investigation called the NHS critical. He pointed to things like just trying to get a GP appointment or seeing a dentist. Yeah. It's a struggle. And then the outcomes for major killers like cancer seem to be lagging behind similar countries. It feels like a system under real strain.
Absolutely.
Yeah.
And that strain, it ripples outwards, doesn't it? It causes real pain and suffering for families. It stops people working, which hits the economy. It actually worsens inequality. And it puts pressure on other services, too. The plan warns that without big changes, things like our aging population will just pile on more pressure, which could mean worse access, worse outcomes, maybe even more people feeling they have to go private if they can afford it. And that erodes that whole founding principle, solidarity.
Right, that core idea of care for all based on need. So it feels existential. Now, the government has made some efforts. The plan acknowledges that. It mentions, 4 million extra appointments, recruiting more GPs?
Yes, over 1,500 newly qualified GPs delivering extra appointments. They mentioned those initial steps.
But clearly the message is much more is to be done.
Exactly. And what's interesting is this apparent consensus for radical change. They talk about the biggest conversation about the NHS in its history. Thousands of staff, members of the public chipping in online. Someone from Leicester is quoted saying pretty starkly, if something radical doesn't change, then the NHS as we know it will not be able to continue to exist. And there's this double injustice point too. Working class communities often get hit hardest, worse access, worse outcomes.
Okay, so here's where it gets really interesting then. Despite all this pressure, the plan isn't saying ditch the founding principles. Universal care, free at the point of use based on need that stays. Instead, it's about transforming how care is delivered. So what does that actually feel like for you as a patient?
It means fundamentally rethinking things around three big radical shifts. Think of them as pillars. Moving care from hospital to the community, shifting from analog to digital, and moving from focusing on sickness to really focusing on prevention. And the thread connecting all three, putting power in patients' hands.
Okay, let's take that first pillar. From hospital to community, they call it the Neighbourhood Health Service. Right now, it often feels like everything revolves around the hospital, doesn't it? And services can feel fragmented. You sort of come to care. How does this vision change that?
The idea is to flip that, bring care to the community. So establish a neighborhood health center in, every community, a sort of one-stop shop.
Yeah.
Open long hours, at least 12 hours a day, 6 days a week. The aim is to cut down hospital visits by having lots of services right there, locally. Think GPs, nurses, mental health support, maybe even social care, all working together.
A one-stop shop. So does this mean finally ending that, the 8 a.m. scramble for a GP appointment? That's such a source of frustration.
That's absolutely the goal. Bring back the family doctor is the phrase they use. They point to examples like a medical center in Brondesbury, London, that uses total triage. So all requests, online or phone, go through an e-consultation first to get people to the right place quickly. No more frantic dialing at 8 a.m. And places like Primary Care Sheffield show how managing GP practices at scale can boost capacity, offering thousands more appointments, especially when demand surges. It shows it can be done. And this shift, it also tackles things like, what the plan calls the disgraceful spectacle of corridor care in hospitals. patients on trolleys. The aim is to get back to that 92% target for starting elective treatment within 18 weeks. For dentistry, new dentists will have to do a minimum stint in the NHS, maybe 3 years. There's a big push on kids prevention, supervised toothbrushing, fluoride varnish, more water fluoridation like in the Northeast, which could help millions by 2030.
And what about things like outpatient appointments? If you have a long-term condition, those regular hospital trips can be a real drag.
Yeah, they're looking at redesigning those too. Things like patient-initiated follow-up becoming standard by 2026. So you decide when you need an appointment based on your symptoms, not just a fixed schedule. More virtual consultations, obviously. And these advice and guidance systems, where GPs can get specialist advice without actually referring you, they apparently diverted 1.3 million referrals last year alone. For urgent care, it's about better navigation using 111, the NHS app. There's a My NHS GP tool planned by 2028, plus expanding dedicated mental health emergency departments.
So if more care moves out into these neighborhood health centers, what happens to the big hospitals? What's the hospital of the future?
Well, the idea is they get freed up to focus on the really complex stuff. World-class specialist care, major surgery, cutting-edge research. The plan envisions hospitals being fully AI-enabled within this 10-year time frame. Centers of highly specialized, tech-driven care, but with less pressure from routine things.
Okay, this sounds like a huge logistical shift, moving away from that traditional hospital focus. And it really feels like technology is, well, it's not just a nice to have, it's absolutely central, isn't it?
Totally central. Which brings us neatly to that second radical shift, from analog to digital, really putting power in your hands.
Yeah.
The plan's quite honest, calls the NHS currently a 20th century technological laggard.
But the ambition is huge.
Yeah.
Become a 21st century leader. And it points out the NHS actually has unique advantages here. Amazing data, massive buying power, and the ability to ensure everyone gets access.
Right. This is the doctor in your pocket idea, mainly through the NHS app. Exactly. The NHS app is positioned as the key tool. By 2028, the aim is for you to have control over a single patient record via the app, securely. And this isn't just your basic notes. It includes medical history, genomic data, maybe even lifestyle data, all feeding into more personalized predictive care. They even mention Estonia's system as a kind of model citizens there can see who's accessed their records. Real transparency. And the app itself will do a lot more. My NHS GP for instant non-urgent advice, 24/7. My Choices to help you pick providers based on wait times, quality, patient feedback, giving you real choice. My Specialist for self-referrals where it makes sense. My Medicines to manage prescriptions, maybe even warning about drug interactions. Eventually, they think they could save billions. There's also My Children, a digital red book for parents, and My Carer, so someone else can securely access records on your behalf, making things easier.
And beyond you using the app, how does this digital drive help the NHS run more efficiently? That seems like a massive win, potentially.
Huge potential. Automating bookings, using virtual appointments to reduce physical ones, and AI scribes. Get this. A trial in London using AI scribes, basically voice tech that writes notes, automatically cut paperwork time by over 50%, saved 6 minutes per patient. Scale that across all A&Es in England, and they reckon it could free up capacity to see over 9,200 extra patients every single day.
Wow, 9,000 just from AI taking notes. That's incredible.
Incredible. And they also plan a health store, like an app store, but for approved digital health tools procured by the NHS for better prices and quality assurance.
Okay, so it's not just about treating illness more efficiently, it's also fundamentally about stopping it happening in the first place. That feels like a really big shift in mindset for the NHS, moving away from just being a sickness service.
It is. That's the third radical shift, from sickness to prevention. The aim is to move from mainly reacting to illness to proactively being a health service, tackling the big preventable diseases head on. And a key goal here is having the gap in healthy life expectancy between the richest and poorest areas. That's a big measure of inequality.
A huge societal goal, yeah. So what are the big prevention moonshots the plan talks about?
There are some really bold ones. First, the smoke-free generation, using that tobacco and vape spill to make it illegal to sell tobacco to anyone born this year or later. That alone, they project, could save the NHS £6.6 billion by the end of the century. Plus, cracking down hard on youth vaping, stopping ads, restricting flavors, displays, that's doubled recently, which is worrying. And a health coach program to help people quit. Second, a major push to end the obesity epidemic. Restricting junk food ads aimed at kids, banning those high-caffeine energy drinks for under 16s, potentially £7.7 billion in health benefits there. Better school food standards. Boosting the Healthy Start scheme. Expanding free school meals for kids on universal credit by late 2026. Reforming the sugary drinks tax to push companies further. And this is a world first. mandatory reporting for big food companies on how healthy their sales are, with targets to improve, plus expanding access to those new weight loss drugs, the GLP-1s, through pay-for-impact deals, so the NHS only pays if they actually work for patients.
Pay for impact. Interesting. And what about just general healthy living, getting people moving?
Yeah, they're planning collaborations, like with the Great Run Company, for a national campaign, and a new digital NHS points scheme, like that pilot in Wolverhampton or Singapore's app you earn points for healthy choices, maybe vouchers. Gamifying health, kind of. Other things include mandatory alcohol labeling with health warnings and nutritional info, like they do in South Korea, improving air quality, decarbonizing transport, investing over $600 million in walking and cycling routes. And this is quite fundamental, a new genomics population health service by the end of the decade. This means things like universal newborn genomic screening, checking a baby's genetic code at birth for potential risks, and using things like polygenic risk scores across the population to spot risks early for conditions like heart disease or diabetes. It's about providing care based on risk, proactively, not just waiting for someone to get sick. And finally, linking health to work better, tackling health-related economic inactivity, people out of work due to illness, which costs the government and the NHS a lot.
Yeah.
So initiatives like health and growth accelerators, putting employment advisors in those neighborhood health centers. And for young people, expanding mental health support in schools, early help for kids with SEND.
That is an incredibly wide-ranging set of prevention goals. It feels like a real attempt to reshape public health. But doing all this, the community shift, the digital revolution, the prevention drive that requires the NHS itself to change fundamentally, doesn't it? How does the system gear up to actually deliver all this? It sounds like the whole engine needs rebuilding.
You're absolutely right. That scale of change needs fundamental shifts in how the NHS operates, its structure, its workforce, how it uses innovation, its finances. These are the enablers of transformation.
Okay, let's look at the first one. A new operating model. Moving away from power being held centrally in Whitehall. How does it push power out to local areas, to providers, and to patients themselves?
Well, one idea is earned autonomy. So high-performing hospitals or services get more freedom, more flexibility. But there's also a failure regime for those underperforming to ensure accountability. Those integrated care boards, the ICBs, they become the key strategic bodies locally, with multi-year budgets for proper planning. And their boundaries will line up with local government, like combined authorities, for better joined-up working. And they're getting rid of integrated care partnerships just to simplify things.
Okay, and you mentioned empowering patients directly. The New Choice Charter is key there. How does that give patients more say?
It works through 5 main ways. First, NHS funding will actually start reflecting patient feedback, including these patient power payments, where your experience could directly influence how much a provider gets paid. Second, a big expansion of personal health budgets, giving you more direct control over money for your care. Third, the NHS app transformation we talked about, putting info and choices in your pocket. Fourth, enabling direct self-referral to some diagnostic tests or specialist services where it's appropriate. And fifth, much clearer choices for planned treatment, seeing different providers, comparing their waiting times, travel times, quality scores, outcomes. Real informed choice.
So more patient power, shifting accountability. What about transparency? We know past scandals often involve things being hidden. How does this plan tackle that?
Transparency is painted as absolutely crucial. Those past failures, Stafford, maternity care issues, they often stem from a lack of openness. The ambition stated here is to make the NHS the most transparent healthcare system in the world.
That's a huge claim. Publishing all quality measures. How easy will that be for ordinary people to actually understand and use?
Well, the plan is for easy-to-understand league tables, published quarterly, ranking providers from high-performing down to failing. So, pretty clear comparisons. And importantly, publishing quality data based on council areas, not just internal NHS boundaries, which makes more sense to the public. By 2029, universal use and publication of PROMs, patient-reported outcome measures, so how treatment affects your health, and PRIMs, patient-reported experience measures, so your feedback on the care itself. Available on the app, too. Direct feedback via the app will be collected and turned into actionable recommendations. There's also that independent investigation into maternity services, plus a national task force, improving the complaint system, strengthening the freedom to speak up channels for staff whistleblowers, and reforming the regulator, the CQC, to be more intelligence-led, using data and AI to spot problems early, with powers to access all NHS data, plus revitalizing the National Quality Board.
Okay, loads on transparency, but none of it works without the people, right? The NHS workforce, they've had a tough time. What's the plan for them?
Yeah, staff morale is critical. The plan acknowledges this directly and actually rejects the previous workforce plan's assumption of just ever-increasing staff numbers.
Yeah.
This new 10-year workforce plan aims for fewer staff overall by 2035 than previously projected. But the focus is on them being better treated, better trained, with more exciting roles and real hope. It's about quality, not just quantity.
Fewer staff, but better supported. So what does that actually mean day to day for a nurse or a doctor?
A big part is using tech to free up time to care. Those AI scribes, again, potentially cutting paperwork by half, freeing up hours. A digital-first HR system to automate things like rotas, recruitment. Staff need to be AI-trained, digitally confident. So, new training pathways, skills escalators, personalized career coaching planned by 2035. Training curricula across the board will be updated to include AI and digital skills, plus more generalist skills needed for those neighborhood health services. For doctors specifically, they mentioned reviewing training pathways and creating 1,000 new specialty training posts, and making the NHS a great employer. New staff standards by April 2026 covering things like decent food, protection from violence or harassment, healthy working patterns, flexible options. The aim is to cut sickness absence down to 4.1%, saving maybe 200 million a year. And this is a big one, aiming to eliminate spending on agency staff by the end of this parliament. That could potentially free up $1 billion over 5 years, money currently spent on expensive temporary cover. Alongside that, reducing reliance on international recruitment, aiming for less than 10% by 2035, and focusing more on training and recruiting locally, which also helps social mobility.
Eliminating agency spending, that's a huge target. And the whole plan relies so heavily on tech and science. How does the NHS actually become a world leader in innovation, not just playing catch-up?
The ambition is massive, to be in the driving seat of the biggest industrial revolution since the 19th century, but in healthcare. They identify 5 transformative technologies as their big bets. First, data, making it flow seamlessly, securely. There's a $600 million joint investment in a new health data research service. Second, AI, using it everywhere for productivity, patient choice, helping staff. AI as a trusted assistant for clinicians, built into pathways by 2035. AI-enabled hospitals, AI in drug discovery, regulated quickly and safely. Third, genomics and predictive analytics. That shift to preemptive, personalized care from birth. Universal newborn sequencing, a big adult genome sequencing study using genetics for prevention. Fourth, wearables, making care real-time, standard by 2035. Continuous glucose monitors, remote heart monitoring by 2028, feeding data into the NHS app, supporting virtual wards at home. And fifth, robotics, for precision surgery, expanding robot adoption. And robotic process automation for admin tasks in hospitals and pharmacies.
So it's about adopting the tech, but also getting it to patients faster, right? That's often where things slow down.
Exactly. Getting the basics right. Speeding up clinical trials target of 150 days by March 2026. Integrating the Be Part of Research platform with the NHS app, making it easier for you to sign up. Making sure regulations can keep up with new tech. Streamlining how the NHS buys innovative products, and setting up regional health innovation zones to test new ways of commissioning and adopting innovation locally, like sandboxes for change.
And all this innovation, the structural changes, the workforce plan, how does it all come together to fix the NHS finances? That feels like the bottom line.
That's the final enabler. Productivity and a new financial foundation.
Yeah.
The plan tackles this head-on. It states pretty clearly that more money has not always led to better care. So the aim is to bend the cost curve, get more value, better outcomes for the money spent, value-based healthcare.
Okay, so is there a specific productivity target?
Yes, a 2% year-on-year productivity gain for the next 3 years, just to get back to pre-pandemic levels initially. And to measure this properly, they've got Andy Haldane, former Bank of England chief economist, doing an independent review to create a new productivity index for the NHS. And critically, those 3 big shifts we discussed all feed into this. Community care is generally cheaper than hospital care. Digitalization boosts productivity at lower cost. Prevention, long-term, reduces demand. Specific reforms include restoring financial discipline, no more automatic bailouts for deficits, moving to longer, 5-year financial plans, new incentives, those patient power payments, rewarding high-quality teams financially, fairer funding allocation to areas with the greatest need, reforming how capital projects are funded, letting Foundation Trust manage assets, using public-private partnerships for the new neighborhood centers, but crucially, learning lessons from past PFI deals, those expensive private finance initiatives, and just making better use of the buildings the NHS already has.
It really does touch every single part of the service, doesn't it? Infrastructure, people, money, tech, all aiming to make it fit for the future. This has been, well, a really comprehensive deep dive. This plan is just vast, isn't it? It reaffirms those core NHS principles, universal care, free at the point of use, but proposes such profound changes in how it's delivered. We've talked about the shifts to community, digital, prevention, all driven by this huge technological ambition.
Yes, and that common thread runs through it all. Putting power in your hands, the patient's hands. It's a conscious move away from NHS knows best towards a model where, as the plan puts it, patients don't just want a service. We want a say. It's really about delivering, or aiming to deliver, real choices, faster responses, and a say in how your care is delivered and where.
So looking ahead, the plan paints this picture of healthcare that's not just free when you're sick, but maybe even free at the point of risk, stepping in before illness hits. A much more proactive, personalized NHS. The plan ends with this line: "If we succeed, we will be able to say with pride that we were the generation that built an NHS fit for the future and a fairer Britain."
It's a powerful ambition. But given the sheer scale of it all, shifting services, embedding AI, tackling huge public health issues like obesity, changing financial models, transforming the workforce, what do you, listening now, think is the single most critical thing, the one factor that absolutely has to go right for this 10-year plan to actually deliver that revolution and build that healthier, fairer future? What's the linchpin?